Hello, I'm Cheri Sabraw, your host for the Washington Hospital Experience, a series of short segments highlighting some of the many service lines here at the hospital. Today, we're going to visit Washington's Special Care Nursery and learn how the nursery's collaboration with the UCSF Benioff Children's Hospital gives our community a facility that provides the finest neonatal and specialty care available. When we toured Washington Hospital's birthing center in another episode, we saw why it's one of the most highly regarded centers of its kind in the state. Now let's look more closely at the center's Special Care Nursery. The Special Care Nursery is an 11-bed intermediate intensive care unit with a team of highly trained neonatologists and nurses who provide around-the-clock care in a hospital setting for newborns who require additional diligence because of illness or prematurity.
Level 2 Special Care Nursery, it takes care of babies who are medium illness, not super sick, but needing more care than we can provide in the mom's room. So it would mean a baby that is usually at 32 weeks in gestation and above, and is also about 1.5 kilos, which is about 3.5 pounds or so in terms of size. And we can take care of those babies well here.
Opened in 1995, it's the only Level 2 intermediate intensive care nursery in southern Alameda County. In the past 10 years alone, the Special Care Nursery has cared for an estimated 2,800 babies.
It's really important to have a special care nursery in the Tri-City community. It enables the families that are going to have a baby that might be sick, or a family that's going to deliver a premature baby, to deliver here and be hopeful and that the baby will be able to stay here in the Tri-City area at Washington Hospital throughout the hospitalization.
Gabriel was born at Washington Hospital. Things got a little complicated, so we unfortunately went into having an emergency C-section, and that was huge fear. That's all I thought about, was thinking that my son wasn't going to be there when we were done and what was going to happen from there. Luckily, that was not the case, and he was able to remain there at Washington Hospital. He was admitted into the special care unit. They took great care of both of us.
Mom has an easier access to our unit because they belong to the same floor while they're recovering from the postpartum period. That when they're feeling better, they could come right to their unit. Either they can walk to our unit, or the nurses in the birthing center will put them in a wheelchair if they can't walk. Sometimes they just had a cesarean section and it's hard to walk. So the nurses would put them on a wheelchair and bring them closer to our baby, and they start bonding with the baby.
We're here at UCSF Benioff Children's Hospital in San Francisco to meet with the staff and talk about the unique relationship between Washington Hospital and UCSF Medical Center. While Washington Hospital's Level 2 Special Care Nursery cares for premature babies that are born at 32 weeks gestational age and after, more fragile infants born before 32 weeks are transferred to UCSF's advanced 50-bed Level 4 Intensive Care Nursery.
UCSF is one of the few Level 4 nurseries in California. And to be a Level 4 nursery, you have to provide the highest level of care, which is mainly actually subspecialty pediatric care and neonatal care in particular that can't be provided at other nurseries and Level 3 nurseries.
As a Level 4 nursery, the unit in San Francisco has the expertise and technology to treat the smallest, sickest, and most fragile babies who may require mechanical ventilation or surgery.
With the combination of a Level 2 nursery and a Level 4 nursery, all mothers in the Bay Area and in the Washington area in particular can feel that they're going to receive the best care possible for their baby.
Jeremiah was born on March 18, 2014 at Washington Hospital. He didn't stay long. He was immediately transferred to UCSF Hospital in San Francisco, where they could care for him at a higher level. He stayed there for about 6 weeks, and then he was healthy enough to not go home yet, but to come back to where my family and friends are and closer to the hospital where he was born at, which is Washington Hospital.
Known for innovation, technology, and compassionate care, UCSF Benioff Children's Hospital is recognized worldwide as a leader in children's health. Every year, it provides over 1,000 babies patient and family-centered care, and the expertise of more than 150 pediatric specialties.
So our new Mission Bay Hospital was actually designed in support with our Family Advisory Council. So every space was developed with a family in mind to make it either comfortable, quiet, having all the resources that a family needs when they're taken outside of their home environment. We are the only hospital in San Francisco that has a helipad on our roof. So we actually have Bear Force One, our helicopter that brings in critically ill patients to the Children's Hospital, that lands directly here. We no longer have to go through SFO and land and then bring by ambulance. So it's greatly increased the transport time so that we can get here much quicker with these patients.
As we've seen, if you are a parent in the Tri-City area whose newborn son or daughter is in need of special medical attention, you'll be able to rest easier, knowing that the specialized world-class care your baby needs is available right here at Washington Hospital's Special Care Nursery. And should it be necessary, you'll have quick access to the expertise and technological advances of UCSF Benioff Children's Hospital.
I really like taking care of babies and trying to get them back to the moms as soon as possible. Obviously it's a sadness when the baby's sick, but often we can make a great improvement in their health pretty quickly. Moreover, I work with a great team, nurses, colleagues, physicians, and just the team at UCSF. And so I feel that I'm very well supported here and the babies get excellent care.
Every day is a new excursion here. Every day is a different patient population. Every day is a different experience. But that's why we all love it and do what we do here.
So let me say that we're starting just with neonatology itself, which I think, as I said, really should enable expectant mothers to feel like their baby is going to get the best care as soon as it's born, but also that the overall UCSF Washington Hospital relationship means that there are going to be other services that are up and coming that are going to expand this care and relationship even more.
I was so relieved that we had the special care unit right there at Washington Hospital to take care of Gabriel's needs during this really critical time. I'm so grateful to all the doctors and nurses, and grateful knowing that we have the facility there. We didn't have to go anywhere else. And it was a really scary time for myself and my family. And I'm just grateful that we have something at Washington Hospital to take care of families and Gabriel.
To find out more about Washington Hospital's Special Care Nursery, call 510-818-5040 or visit the nursery's website, www.whs.com/special-care-nursery. For more information about UCSF Benioff Children's Hospital, visit www.ucsfbenioffchildrens.org.